Imagine this: you wake up one morning, and something feels just a little off. You're more tired than usual, but you shrug it off, thinking maybe you just didn't sleep well. Later that day, walking up a small flight of stairs leaves you slightly breathless, which surprises you because you've done it countless times before. A week later, you notice your socks leaving deeper marks around your ankles, as if your legs are swelling. Once again, you brush it aside, telling yourself, it's probably just water weight. But what if I told you that these small, seemingly harmless changes could actually be early warning signs of something much more serious? Something that millions of seniors experience without even realizing it until it's too late. I'm talking about heart failure, a condition where your heart is no longer pumping blood as strongly as it should. Here's the frightening truth: heart failure rarely announces itself with a dramatic heart attack or sudden collapse. Instead, it sneaks up on you. It whispers before it shouts. It hides behind symptoms so ordinary that most people mistake them for aging, fatigue, or stress. And because of this, many seniors don't seek help until the condition has progressed dangerously far. According to health experts, more than 6 million Americans are living with heart failure, and a large percentage of them are over the age of 60. What makes this statistic even more alarming is that early detection and treatment can slow down or even prevent the worst complications. Yet, most people ignore the signs until their quality of life is already deeply affected. That's why in this video, we're diving deep into 13 early signs of heart failure that you might be ignoring every single day. From unusual fatigue, swelling, and persistent coughs, to subtler clues like difficulty concentrating or sudden weight gain, these warning signals matter more than you think. So stay tuned, because by the end of this video, you'll know exactly what to watch out for, and these insights might just save your life, or the life of someone you love. One of the earliest and most overlooked signs of heart failure is persistent fatigue and weakness. Now, it's normal for seniors to feel tired every once in a while, especially after a long day or a poor night's sleep. But what makes heart-related fatigue different is that it doesn't go away with rest, and it begins interfering with your daily activities. Here's why: when your heart isn't pumping blood efficiently, less oxygen and fewer nutrients reach your muscles and tissues. As a result, even simple tasks like folding laundry, cooking a meal, or walking across the room can leave you feeling drained. Many seniors describe it as a heavy, constant tiredness that lingers no matter how much sleep they get. Another clue is weakness. You might notice that your arms or legs feel unusually heavy, or that you can't lift objects that were once easy for you. For example, carrying groceries, gardening, or even climbing into bed might suddenly feel like hard work. The tricky part is that many people chalk this up to just getting older. They assume slowing down is a natural part of aging. But in reality, persistent fatigue is your body's warning signal that your heart isn't keeping up with your body's demands. If you or someone you care for notices this kind of ongoing tiredness, especially if it's paired with other symptoms like swelling or shortness of breath, it's worth bringing up with a doctor. Remember, early recognition can make all the difference in managing heart failure before it advances. So, if you find yourself feeling unusually weak, exhausted, or struggling with basic tasks, don't ignore it. Your heart might be quietly asking for help. Another early sign of heart failure is shortness of breath. At first, you may notice it only when climbing stairs or walking longer distances. But as the condition progresses, it can show up even when you're sitting or lying down. Why does this happen? When the heart can't pump blood efficiently, fluid starts building up in the lungs. This makes it harder for you to breathe deeply. Some seniors wake up in the middle of the night gasping for air or needing extra pillows to prop themselves up. If you find yourself struggling to breathe at night, or if normal activities suddenly leave you winded, don't ignore it. This is one of the clearest signs your heart needs medical attention. Swelling in the lower body, also called edema, is another common red flag. When the heart can't circulate blood effectively, fluid tends to collect in the tissues, especially in the ankles, feet, and legs. You might notice your shoes feeling tighter, socks leaving deep marks, or legs looking puffy by the evening. Many seniors blame this on standing too long or water weight, but persistent swelling is often linked to heart problems. In advanced cases, swelling can even spread to the hands, abdomen, or lungs, making breathing more difficult. The key is to watch for consistent swelling that doesn't go away after rest. This is your heart signaling that blood isn't moving as it should. Your heart is like the rhythm section of your body. But when it's weak, it can start beating too fast, too slow, or irregularly. This is called arrhythmia. Many seniors with early heart failure describe feeling a fluttering or pounding sensation in the chest. Others notice their pulse racing unexpectedly, even when they're not exerting themselves. An irregular heartbeat means your heart is working harder than it should to circulate blood. Over time, this extra strain can worsen heart failure. If you often feel your heart skipping beats or racing, it's important to get checked right away. A symptom many people ignore is a chronic cough or wheezing. This isn't the kind of cough you get from a cold. It's usually dry, persistent, and sometimes produces pink or white mucus. The reason? When fluid builds up in the lungs due to heart failure, it irritates the airways and makes breathing harder. Some people even mistake this for asthma or bronchitis. If you've had a cough that won't go away, especially if it's worse at night or when lying flat, it could be your heart trying to get your attention. This is a red flag not to overlook. If you find yourself waking up multiple times at night to urinate, it may not just be age or prostate issues, it can also be an early warning sign of heart failure. Here's why: when you lie down, fluid that has built up in your legs and ankles during the day returns to your bloodstream. Your kidneys then filter this extra fluid, making you feel the urge to urinate more often at night. Many seniors think this is just a part of getting older, but if it happens alongside swelling, shortness of breath, or fatigue, it may be linked to your heart's weakening ability to pump blood efficiently. This constant disruption at night doesn't just affect sleep quality, it's your body's way of showing that fluid balance is out of control because the heart is struggling. So, if nighttime bathroom trips are increasing, it's worth mentioning to your doctor. Heart failure doesn't just affect the body, it also impacts the brain. Seniors with early heart failure often notice trouble concentrating, forgetfulness, or confusion. The reason is simple: when the heart isn't pumping strongly, less oxygen-rich blood reaches the brain. This can make it harder to stay focused, remember details, or even follow conversations. Some families notice their loved one seems more forgetful, repeats questions, or feels mentally foggy. While these symptoms are often blamed on normal aging or dementia, they can sometimes be linked directly to poor heart function. If confusion or memory problems appear suddenly or worsen over time, especially when combined with fatigue or shortness of breath, it's a strong signal that heart health needs attention. Another subtle sign of heart failure is losing interest in food or feeling full quickly. Some people even experience nausea or stomach discomfort. This happens because when the heart weakens, blood flow to the digestive system decreases. At the same time, fluid buildup in the abdomen can make eating uncomfortable. Seniors often describe it as having no appetite, even for favorite foods, or feeling bloated after just a few bites. This loss of appetite can lead to unintended weight loss and nutritional deficiencies, making the body even weaker. If you notice persistent nausea, fullness, or disinterest in eating, it could be more than a stomach issue, it may be a sign your heart is under strain. One of the most important warning signs of heart failure is sudden, unexplained weight gain. We're not talking about gradual changes over months, but a sharp increase of 2, 3, or even 5 pounds within just a few days. This happens because the body retains fluid when the heart can't pump blood properly. Extra fluid builds up in the tissues, causing swelling in the ankles, legs, abdomen, and even around the lungs. Doctors often advise people with heart failure to weigh themselves daily, because sudden weight gain can be an early sign that the condition is getting worse. If you notice the scale creeping up quickly without changes in diet, it's time to act immediately. While most people associate swelling with the feet or legs, abdominal swelling, also called ascites, is another serious sign of heart failure. When fluid builds up in the belly, it can make the abdomen look enlarged or bloated. This can cause discomfort, indigestion, loss of appetite, and sometimes even difficulty breathing if the swelling is severe. Many seniors confuse this with weight gain or digestive issues, but persistent abdominal swelling is often linked to fluid overload caused by poor heart function. If you notice your waistline expanding quickly without a clear reason, or if clothes suddenly feel tighter around the midsection, this could be your heart's warning sign. Don't ignore it. Another early red flag of heart failure is what doctors call exercise intolerance. This doesn't mean running marathons or lifting heavy weights, it simply means your body struggles with even light physical activity that once felt easy. For example, maybe you could comfortably walk a few blocks, but now you're winded halfway through. Or perhaps gardening or light housework leaves you exhausted and needing to sit down. This happens because a weakened heart can't pump enough oxygen-rich blood to meet the body's increased demand during activity. Muscles tire quickly, breathing becomes harder, and recovery takes much longer. Many seniors dismiss this by saying, "I'm just slowing down with age." But when activity levels suddenly drop, or when light exertion feels unusually difficult, it's often a warning that your heart isn't performing as it should. Recognizing this early can help you get medical care before the condition worsens. If your hands and feet often feel cold to the touch, even in warm environments, it may be a sign of poor circulation linked to heart failure. When the heart struggles to pump blood efficiently, the body prioritizes sending oxygen to vital organs like the brain and heart itself. This means less blood reaches the extremities, causing cold, pale, or even bluish fingers and toes. Some seniors notice their nails turning slightly purple, or their skin feeling unusually cool. While poor circulation can have other causes, such as diabetes or peripheral artery disease, it is also a frequent symptom of heart failure. If cold hands and feet are new, persistent, or accompanied by other warning signs like swelling or fatigue, it's a signal your heart may not be delivering blood as it should. Finally, one of the most overlooked but significant signs of heart failure is increased anxiety or restlessness. When your heart struggles, your brain senses that the body isn't getting enough oxygen. This can trigger feelings of unease, nervousness, or even panic. Some people report waking at night feeling restless, unable to breathe comfortably, or experiencing sudden anxiety attacks. In seniors, this symptom is often misunderstood as stress, depression, or sleep problems. But when anxiety is paired with physical symptoms like shortness of breath, fatigue, or swelling, it could be your heart signaling distress. Ignoring these feelings can be dangerous, because emotional health is closely tied to physical health. If restlessness or anxiety appear alongside other warning signs, it's time to seek medical evaluation. We've just explored the 13 early signs of heart failure that so many seniors overlook every single day. And now, as we close this video, I want you to pause for a moment and really reflect on what this means for you or someone you love. Heart failure isn't something that happens suddenly, like flipping a switch. It develops slowly, silently, step by step. It's the body's way of saying, "I'm under strain. I'm working harder than I should. Please pay attention." The problem is that most of these warning signs are so easy to dismiss. We tell ourselves, "I'm just getting older," when fatigue sets in. We say, "It must be the weather," when our feet start swelling. We assume a nagging cough is allergies or that breathlessness is just lack of fitness. But what if these small changes are actually your body's whispers? Whispers that, if ignored, will eventually become shouts? The truth is simple, your heart whispers before it shouts. And by the time it shouts, In the form of a hospital visit, a frightening emergency, or severe heart failure, the damage is much harder to control. That's why awareness is power. I want you to imagine two different futures. In one, you ignore the signs, you keep pushing through the fatigue, brushing off the swelling, dismissing the shortness of breath. Weeks turn into months, until one day, a serious event forces you into the hospital. Suddenly, you're left wishing you had acted sooner. But in the second future, you listen to your body. You notice the changes, you learn from them, and you talk to your doctor early. With proper treatment, lifestyle adjustments, and monitoring, you slow down the progression of heart failure. You maintain your independence, your energy, your time with family. That's the power of taking action early. And here's some encouragement: a diagnosis of heart failure is not the end. Many seniors live long, fulfilling lives after discovering the condition, because they managed it with the right care. Medications, healthier habits, low-salt diets, staying active, and regular checkups can make all the difference. But the key is awareness. You can't treat what you don't recognize. So, what should you do next? Start paying attention to your body's signals. If you notice ongoing fatigue, swelling, shortness of breath, or sudden weight gain, don't dismiss it. Track your symptoms. Even keeping a simple journal of changes in your weight, energy levels, or sleep patterns can reveal trends you might otherwise miss. See your doctor. Don't wait for things to get worse. Even if you're not sure it's heart failure, it's better to be safe than sorry. Share this knowledge. Someone in your family, a friend, or a neighbor might be silently struggling right now, chalking up their symptoms to aging, when in fact they could be at risk. And to you, the viewer who has stayed with me until the end, you've already taken the first and most important step: you've educated yourself. Knowledge is the foundation of prevention. The next step is action. If you found value in this video, please like this video. It helps us reach more people who may desperately need this information. Don't forget to subscribe to our channel, because we bring you life-saving health tips designed especially for seniors and their caregivers. And most importantly, share this video with your loved ones. You never know whose life you might save simply by passing along this message. Remember this final thought: your heart is the engine of your life. Without it, nothing else functions. Treat it with care, listen to its warnings, and don't ignore the whispers. Because the earlier you listen, the more control you have over your future. So take care of yourself, take care of your heart, and take care of the people you love. Life is too precious to let it slip away because of symptoms we brushed aside. This is not just about living longer, it's about living stronger, healthier, and more joyfully. Protect your heart today, and it will protect you for years to come.